Namaste Bitya, myself JVN Neha Saini. Here I am going to tell you about the anatomy of the gluteal region. Gluteal region is also known as the buttocks. It is the region behind the pelvis which is extending from iliac crest superiorly to the gluteal fold, that is the fold of the buttock inferiorly. The diagram is showing you the gluteal region. Gluteal fold indicates the lower border of the gluteus maximus muscle. The gluteal sulcus or the crease is a skin crease for the hip joint. The deep midline groove, the natal cleft, separates the buttocks from each other. The thick, dense structure lying beneath the skin of the gluteal region is the superficial fascia, which is laden with large quantities of fat, especially in women. That gives the characteristic convexity to the buttock. It forms a thick cushion over the ischial tuberosity. The cutaneous supply over here has been divided into quadrants, 4 quadrants. The upper lateral quadrant is supplied by the lateral branches of iliohypogastric nerve, that is from L1 and T12. The upper medial quadrant is supplied by the posterior rami of L1, L2, L3 and S1, S2, S3. The lower lateral quadrant is supplied by the branches of lateral cutaneous nerve of the thigh. The lower medial quadrant is supplied by the branches of posterior cutaneous nerve of the thigh. The skin in the floor of the natal cleft is supplied by the branches of the sacral and the coccygeal nerves. The skin and the fat of the gluteal region is supplied by the perforating branches of superior and the inferior gluteal arteries. They drain into lateral group of superficial inguinal lymph nodes. Now the deep fascia, it is the continuation of the fascia lata, that is the deep fascia of the thigh. At the lower border of the gluteus maximus, the deep fascia splits to enclose the muscles. Above the gluteus maximus, the deep fascia continues as one layer covering the gluteus medius and gets attached to the iliac crest. Laterally, the fascia merges with the iliotibial tract. The gluteal region contains the bones, ligaments, muscles, vessels and the nerves. The bones include the hip bone, the femur and the hip joint. The ligaments include the sacrospinous and the sacrotuberous ligament. Sacrospinous ligament connects the sacrum to the ischial spine. Sacrotuberous ligament connecting the sacrum to the ischial tuberosity. They convert the greater and the lesser sciatic notches into greater and lesser sciatic foramina. Their main function is to stabilize the sacrum, prevent its posterior rotation at the sacroiliac joint. The structures passing through the greater sciatic foramen includes, which are showing in your diagram, that is the piriformis muscle, the superior gluteal vessels and nerves. The structures passing through the lesser sciatic foramen includes the muscles which are lying below the piriformis. The muscles of the gluteal region includes the gluteus maximus, medius, minimus, tensor fascia lata, piriformis, superior gemellus, inferior gemellus, obturator internus and the quadratus femoris. The gluteus maximus is the largest muscle of the body. It forms the prominence of the buttock. It arises from the outer surface of the ilium behind the posterior gluteal line, lumbar fascia, posterior surface of sacrum and coccyx and sacrotuberous ligament. It is inserted in 2 forms, that is the most of the part of the muscle, that is 3/4 part, is inserted into the iliotibial tract and the deeper fibers are inserted into the gluteal tuberosity, and it is supplied by the inferior gluteal nerve. Actions include extension and lateral rotation of the hip joint, extends the knee through the iliotibial tract. It gives simultaneous stability to the hip and the knee joints through iliotibial tract. Gluteus maximus is the chief anti-gravity muscle of the hip, and it is used in standing up from a sitting position, running, climbing up stairs. In each case, extension of the hip moves the trunk upward. The muscle must be extremely powerful to raise the weight of the body against the gravity. This is known as forced extension. Gluteus medius, it arises from the outer surface of ilium between the middle and the posterior gluteal lines, inserted on the lateral surface of the greater trochanter. It is supplied by the superior gluteal nerve. Action, it abducts and medially rotates the thigh, steadies the pelvis in walking. Now the gluteus minimus, it arises from the outer surface of ilium, inserted on the anterior surface of greater trochanter. It is supplied by the superior gluteal nerve. Action is abduction and medial rotation of the thigh. Then the tensor fascia lata, it arises from the outer surface of the edge of the iliac crest between the anterior superior iliac spine and the iliac tubercle. It is inserted into the iliotibial tract. In the diagram we can see the tensor fascia lata muscle, and nerve supply is by the superior gluteal nerve. It maintains the knee in extended position. Now the piriformis, it rises from the anterior surface of S2, S3, S4 vertebrae, that is from the sacrum, and inserted on the upper border of the greater trochanter, that is the tip of the greater trochanter. It is supplied by the anterior rami of S1, S2. Action is lateral rotator of the thigh, assists in stabilizing the hip joint, especially in abduction. Then obturator internus, it rises from the inner surface of the obturator membrane and the adjacent bone, inserted on the upper border of greater trochanter along with gemelli. Nerve supply is by the obturator internus. Action is the lateral rotation of the thigh. Then superior inferior gemelli. The superior gemelli arises from the ischial spine, and the inferior gemelli arises from the inferior part of the ischial tuberosity. Then inserted on the upper border of the greater trochanter. Nerve supply, superior is supplied by the nerve to obturator internus, and inferior is supplied by the nerve to quadratus femoris. Action is lateral rotation of the thigh. Then quadratus femoris. So it arises from the lateral border of the ischial tuberosity, inserted on the quadrate tubercle of the femur. Nerve supply is by the quadratus femoris, and the action is lateral rotator of the thigh. Then the nerves of the gluteal region includes the sciatic nerve, posterior cutaneous nerve of the thigh, superior gluteal nerve, inferior gluteal nerve, nerve to quadratus femoris, pudendal nerve, and nerve to obturator internus. Then arteries of the gluteal region are branches of internal iliac artery, that is superior and the inferior gluteal artery, branches of femoral artery, that is lateral and medial circumflex femoral artery, branches of profunda femoris, that is the first perforating branch. The superior and the inferior gluteal arteries, these are the branches of internal iliac arteries. They enter the gluteal region through the greater sciatic foramina. Superior gluteal artery above the piriformis and inferior gluteal artery below the piriformis. They supply the gluteal region and contributes to the anastomosis around the hip joint. Then we have trochanteric anastomosis. This anastomosis is found on the greater trochanter of femur. Then cruciate anastomosis, it lies at the level of lesser trochanter. Then the bursae around the gluteus maximus include the gluteofemoral bursa, which is lying between the gluteus maximus and the vastus lateralis. Trochanteric bursa lying between the gluteus maximus and the greater trochanter. Ischial bursa lies between the gluteus maximus and the ischial tuberosity. Then the safe area for intramuscular injection in the gluteal region is the outer upper quadrant of the buttock, because here there is minimal chances for the injury to the sciatic nerve. Then the Trendelenburg test to assess whether the hip abductors, especially the gluteus medius, are functioning or not. We observe the patient from behind and ask him to stand on one foot and the other. The negative test includes the pelvis tilts up on the contralateral side, that is the opposite side, and in the positive test the pelvis sags on the contralateral side. The problems that could lead to a positive Trendelenburg test is the fracture of the neck or femur, dislocation of the hip joint, coxa vara, non-functioning of the gluteus medius and minimus due to neurological damage, and any disease which is affecting the muscle, that is any myopathy. So this completes our topic, the gluteus region. Thank you.